college, I had a couple of friends that had a family member. It was a young child who had black fan diamond leukemia. And I watched some of the care that he received and some of the problems that he had going through, and thought that that was a field that I'd like to get into. So I saw, what the family went through, all the treatment that was rendered, and some of the good things that happened, during the treatment and the responses, etc. And so I think that's sort of what sparked my interest in oncology. These days, we're looking at a variety of new targeted therapies and treatments, moving away from chemotherapy, sort of targeting therapy towards each individual and their particular cancer or tumor. Each individual tumor usually has its own specific markers and antibodies, and there's a variety of different treatments that are able to focus and have improved response rates. Whereas chemotherapy is just simply treating everybody with the same thing, and you're hoping that something happens. These people who have these cancers, they're at a loss. They have no idea what they're going to do, and a lot of their physicians don't know how to help them. And so, regardless of whether you're curable or not, you can often make their lives better. And that's certainly very rewarding to them and their family, and it's rewarding to us as well. But I think, the bottom line is what we're trying to do is just make people feel better for what time they have if we can't cure them. My patients, I think we all get to know each other personally. We find out about their families, about, the trips they're taking. I think all of my patients know my kids. They know what schools they're in. They know my hobbies. They know what I've done this past weekend. They know what's coming up, in the future. And these are individuals that you end up seeing maybe once a month for 3 years, or in Mike's instance, once a month for almost 20 years. So you get to know those individuals very well, and they really become family. And the employees that we have here all get to know the patients as well. So it is a special relationship. It's, and they come to trust everything that you do, and they come with questions of other medical problems, and they trust your opinion. Maybe it's a kidney problem or a heart problem, and they always want to get your opinion. So I think there is a tremendous trust, and it is a special relationship. I don't know of any other field that really would have that.